Assalamu alaikum. I am Dr. Mahbubur Rahman Polash, Assistant Professor, Department of Pharmacology at Bashundhara Ad-din Medical College. Today we will discuss about drug used in peptic ulcer disease. Peptic ulcer. Peptic ulcer are chronic, most often solitary lesions that occurs in any portion of the gastrointestinal tract exposed to aggressive action of acid peptic juice. Common sites of peptic ulcer: first part of duodenum, stomach, gastroesophageal junction within the margin of gastrojejunostomy. Here is a picture of stomach. There is two lesions. One is at the pyloric portion of the stomach and another in the first part of the duodenum, and these are the commonest site of peptic ulcer disease. Pathogenesis of peptic ulcer: due to an imbalance between gastroduodenal mucosal defense mechanism and damaging force, this ulcer occurs. Number 1, impairment of defense mechanism. This occurs due to ischemia, delayed gastric emptying, rapid gastric emptying and psychological stress. Following mechanical factors are responsible for this, like decreased mucosal secretion, decreased bicarbonate secretion in mucus, decreased mucosal blood flow, decreased epithelial regenerative capacity and decreased prostaglandin elaboration. Number 2, increasing damaging force that occurs due to the increased gastric acidity, NSAID and steroid, cigarette and alcohol intake, duodenal gastric reflux and Helicobacter pylori. Here is a picture that shows imbalance between hostile factor and protective factors. Approaches of treatment of peptic ulcer disease: two modalities, lifestyle and dietary modifications and drug. Lifestyle and dietary modifications include regular diet, less stress, avoid NSAIDs, take NSAIDs with food, quit smoking and alcohol, weight loss, obesity enhance gastroesophageal reflux disease, avoid hot, spicy and greasy foods, do not eat before bedtime. And drug used in peptic ulcer disease. Number 1, acid neutralizers or antacid. It includes sodium bicarbonate, calcium carbonate, magnesium hydroxide, aluminum hydroxide. Number 2, agents that enhance mucosal resistance or ulcer healing drugs includes sucral fat, prostaglandin analog or misoprostol, colloidal bismuth compounds. And number C, agents that reduce hydrochloric acid secretions. It includes H2 receptor blocker and some H2 receptor blocking drugs are ranitidine, famotidine, nizatidine and cimetidine. Number 2, proton pump inhibitors. It includes omeprazole, esomeprazole, pantoprazole, rabeprazole, lansoprazole and dexlansoprazole. Number 3, antimuscarinic drug. Some antimuscarinic drug have properties of reducing hydrochloric acid secretions like pyrenzipine and talenzipine. Number 4, agents that kill the causative bacteria Helicobacter pylori. These drugs are used to kill Helicobacter pylori are metronidazole, amoxicillin, tetracycline and clarithromycin. Now come to the antacids. Mechanism of actions are: as antacids are weak base, they directly neutralize gastric acidity and they also promote mucosal defense by stimulation of mucosal prostaglandin production. Indications are intermittent heartburn, dyspepsia and peptic ulcer disease. And adverse effect of antacids are gastric distension and belching due to carbon dioxide accumulation, metabolic alkalosis, milk alkali syndrome, osmotic diarrhea due to unabsorbed magnesium chloride, constipation due to unabsorbed aluminum chloride and drug interactions. Drug interactions: antacid causes decreased absorptions and bioavailability of following drugs. There are tetracycline, ciprofloxacin, imidazole and iron preparations. Most drugs interactions can be avoided by taking antacids 2 hours before or after ingestion of other drugs. Now come to proton pump inhibitor or PPIs. Mechanism of actions: proton pump inhibitors are administered as inactive product, then they are converted into active from thiophilic sulfonamide cation in the parietal cell. The sulfonamides reacts with hydrogen potassium ATPase. The proton pump forms a covalent disulfide linkage, irreversible inactivations of the proton pump. Counter transport of hydrogen and potassium ions via the proton pump is blocked. No secretion of hydrogen ion by the parietal cell, decrease HCl secretion into the gastric lumen. They diminish 90 to 98% of 24-hour acid secretion, both basal and mild stimulated in standard doses. Now indications of proton pump: number 1, peptic ulcer disease, Helicobacter pylori associated peptic ulcer disease, NSAID induced peptic ulcer disease, and perforation of bleeding of peptic ulcer disease. Number 2, gastroesophageal reflux disease. Number 3, non-ulcer dyspepsia. Number 4, stress ulcer. Number 5, gastrinoma and other hypersecretory conditions. Adverse effect: they are very safe drug. Only 1 to 5% of cases the following adverse effects are reported: diarrhea, headache, abdominal pain. Prolonged proton pump inhibitor therapy causes subnormal vitamin B12 level and echlorhydria. Now come to the H2 receptor blockers. Mechanism of actions: competitively and reversibly block H2 receptors on parietal cell. Histamine released from enterochromaffin cell by gastrin or vagal stimulation cannot bind to parietal cell H2 receptor. So, no hydrochloric secretion from parietal cell. These are the mechanism. Now, indications of H2 receptor: gastroesophageal reflux disease, peptic ulcer disease, non-ulcer dyspepsia, and stress ulcer. Adverse effects: H2 receptor blockers are extremely safe and well tolerated drug. Adverse effects occurs in fewer patients like diarrhea and constipation, headache, myalgia, fatigue. Cimetidine causes gynecomastia or impotence in men and galactorrhea in women. Misoprostol: misoprostol, a methyl analog of prostaglandin E1. Role of misoprostol in peptic ulcer disease: it gives mucosal protection by stimulating mucus and bicarbonate ion secretions and by enhancing mucosal blood flow. Prostaglandin causes acid inhibition by reducing histamine stimulated cyclic adenosine monophosphate production on parietal cell. Indication of misoprostol: NSAID induced peptic ulcer disease and prostaglandin analog along with NSAIDs to prevent gastric irritations. Treatment of Helicobacter pylori induced peptic ulcer disease: Helicobacter pylori is a gram-negative bacterium, invade gastric mucosa, commonly cause of peptic ulcer and causes chronic gastritis. We should follow the following two regimen: triple therapy and quadruple therapy. Triple therapy is based upon a proton pump inhibitor taken simultaneously with two antibiotics from amoxicillin, clarithromycin and metronidazole for 14 days. Helicobacter pylori eradication is achieved in over 90% of patients. Treatment regimens are: proton pump inhibitor PPIs is 12 hourly for 14 days, clarithromycin 500 mg 12 hourly for 14 days, amoxicillin 1 gram or metronidazole 500 mg 12 hourly for 14 days. After completion of triple therapy, the proton pump inhibitor should be continued once daily for a total of 4 to 6 weeks to ensure complete ulcer healing. Quadruple therapy should be offered to those patients who remain infected after initial triple therapy. The emergence of resistance to clarithromycin and metronidazole is an important factor in the failure to eradicate. Drug regimens are: proton pump inhibitor 12 hourly for 14 days, tetracycline 500 milligram 6 hourly for 14 days, metronidazole 500 milligram twice daily for 14 days, and bismuth 120 milligram 6 hourly for 14 days. Thank you all. This is all about today. Allah Hafiz.